Is your Medicare Advantage plan disappearing in 2026? If you're on a Medicare Advantage plan, also known as Part C, you may be facing fewer choices, higher costs, or even the plan being dropped altogether. In this video, I'm going to reveal what's going on, why it's happening, and exactly what you must do before December 7th window closes. Welcome to the Medicare Truth. I'm Holly Cohen, licensed independent broker, and I bust through that insurance jargon to help you see clearly what's happening with your Medicare coverage. Today, we're digging into the major shifts happening in Medicare Advantage plans for 2026. Make sure you watch through. By the end, I'll give you a step-by-step checklist to make sure you're covered. If you find this useful, go ahead and hit that subscribe and the bell icon so you don't miss future updates. So let's start with the facts. Over the last 2 months, some major developments. Insurers are cutting back on Medicare Advantage offerings. For example, United Health Group announced it will exit Medicare Advantage plans in 109 U.S. counties, affecting 180,000 members. In states like Maine, 36,000 people are set to lose their current Medicare Advantage plan because carriers are pulling out or reducing options. In Vermont, almost all individual Medicare Advantage plans are being discontinued in 2026, all but one provider, according to reports. Nationally, reports show that Medicare Advantage enrollment may shrink for the first time in years. According to analysis, Medicare Advantage plans are seeking fewer perks, higher premiums, and more narrow networks, and increased prior authorizations. So yes, this is a real shakeup, not just a rumor. If you're on Medicare Advantage right now, you should really pay attention. So now let's get into the why. Because, and you'll like this, the reasons have less to do with you personally and more to do with business policy pressures behind the scenes. So there's rising costs and utilization. Insurance companies say healthcare costs for Medicare Advantage members are increasing. Older folks need more services, new and expensive treatments, hospital stays, etc. So, for example, in Massachusetts, one major insurer reported losing $113 million in 1 year on Medicare Advantage business. Payment and reimbursement challenges. The federal payments to the Medicare Advantage insurance companies are under great pressure. One article notes that by 2026, some insurers estimate reimbursements will be 20% lower than 2023 levels, despite small increases built in. Also, major insurers are reducing their Medicare Advantage and Part D offerings because of funding cuts and rising costs. Number 3, risk adjustment and star ratings. Medicare Advantage plans are heavily influenced by how sick enrollees are. Those are called risk scores, and by the quality ratings or those star ratings. When those metrics change, payments shift. For example, reductions in star ratings can cost an insurance company billions in bonus payments. I mean, just look at the recent ruling. Humana Incorporated just lost a challenge to CMS because of a star rating decision. Network provider contract struggles. Some hospital systems or provider networks may renegotiate or withdraw from Medicare Advantage contracts, making it harder for insurance companies to maintain profitable networks. For example, a Michigan system is consolidating its insurance contracts for 2026, which affects Medicare Advantage provider networks. Regulatory and benefit changes for 2026. There are several policy changes coming. For example, Medicare Advantage plans will face expanded prior authorization requirements, reduced extra perks in some markets, and other changes outlined in a recent breakdown of 9 major Medicare changes for 2026. Geography and market variation. So you'll especially see plan exits or reductions in rural or less profitable counties. For example, United Healthcare pulled back in 109 counties, which are mostly rural. Altogether, the business model of Medicare Advantage is becoming more challenging, which means you, the beneficiary, may feel the pinch Okay, so what does this practically mean for you? What should you be doing right now? Action step number 1, open up, please, and read your annual notice of change letter from your insurance company. That annual notice of change letter that you should have received by September 30th, is what will change in your plan for 2026, your network, your premiums, your benefits, your drug lists, etc. If your plan is terminating, it will say so. For example, in Maine, regulators say 36,000 people are losing their Medicare Advantage plans because of carriers pulling out. Action step number 2, check your provider networks. Your doctor, hospital, or specialist may no longer take or participate in your plan's 2026 network. In Massachusetts, for example, providers were dropped from the Medicare Advantage networks. Action step number 3, review your medications and formulary. Your plan's drug list or coverage may change. Also, the new Part D and Medicare Advantage rules will shift costs in 2026. The drugs you take may not be covered. One finance website says you'll see slimmed down benefits in many markets. Action step number 4, compare options. Medicare Advantage versus original Medicare and a Medigap. If your Medicare Advantage plan is changing significantly, narrower network, worse benefits, it may be worth evaluating to go back to traditional original Medicare and add a Medigap or Medicare supplement and a Part D. Keep in mind though, Medigap, you do have to go through medical underwriting if you've had Part B for more than 6 months. Here's a simple decision framework for you. Stay in Medicare Advantage if you're comfortable with your network restrictions, whether it be an HMO or a PPO, and if your doctors are in network for 2026. Consider switching to original Medicare with a Medigap plan such as Plan G or Plan N if your provider network is shrinking or you're losing key doctors or hospitals. But remember, you do have to be in pretty good health to pass underwriting for a Medigap Plan G or a Medigap Plan N. Or if your Medicare Advantage benefits are being cut, or if you're facing big changes in copays or you're maxed out of pocket, or if you want more freedom of providers. Original Medicare does give you more choice and far fewer network restrictions because there are no networks with original Medicare and a Medigap plan. One note, if you switch from Medicare Advantage to original Medicare, in most states there's underwriting. So always speak with a licensed independent broker to find out all of your choices. It's not always a great idea to call into the carrier directly. Usually you will get thrown right into the Medicare Advantage world. When you make that phone call into one of the carriers, that's where they will direct your call. So just make sure you know that when you're calling the carrier directly. And when you're on the phone talking to a licensed independent broker, make sure to check who they are, check their credentials, make sure they're a licensed agent in your state. So there you have it, the truth behind what's happening with Medicare Advantage for 2026 and why it's happening and what you must do to avoid being caught off guard. I'll repeat, check that annual notice of coverage letter if you're on Medicare Advantage. Verify your providers and your medications. Compare your options before December 7th. If you need help walking through options, drop a comment below and we will point you in the right direction for your sources. If you found this video helpful, go ahead and hit that like button, subscribe for more Medicare truth, and share this with someone who's either on Medicare Advantage or new to Medicare. They might not realize what's about to change. Thanks for watching the Medicare Truth, and I'll see you in the next video. As always, please be well.